Hello and welcome to the 11th episode of our Ask a Counselor series. Today we thought we would follow up from our previous recording all about counseling with discussing a little bit about support groups. And Christine is going to start us off.
Yeah, so kind of like we started our last video with individual counseling, we really just wanted to start today kind of by throwing the question out there of, how would I know if a support group might be a right fit for me, or what are some of the benefits of coming to a group? So a couple things that came to mind for us. The first one that we hear from a lot of people kind of seeking group support is just if you find yourself feeling really alone in your experience. Sometimes people will say that when their world has been touched by cancer, they don't really know anybody else personally that they can talk to about the experience. And so if you're really looking to connect with other people who know a piece of what you're going through, to just help you feel less alone in that experience, and also just to kind of connect to that community around you of support, groups can be a great fit. Another thing that groups can be really helpful for is if you're really kind of looking to hear more about just that personal experience, whether you have a diagnosis, you're caring for someone with a diagnosis, or you've lost someone from a diagnosis. Sometimes just talking to other people, I always think about how, sometimes we read books, we read memoirs to hear other people's story, and we can hear some of our own story in that. And so group is just a live version of that. Hearing other people's stories can often help us in our experience, as well as lending support to others. And then the other thing that often comes to mind, it sounds a little goofy, but just kind of connecting with other people who speak the language of cancer, or speak the language of caregiving, or speak the language of grief. A lot of times people will talk about how it does feel like it's just a whole new world that they've landed in when cancer touches their life. And so you're having to learn all kinds of different terminology, and just everything, the lay of the land just looks so different. And so connecting with other people that speak that same language that you're learning or you've been at for a little while really can have tremendous benefits for us. A lot of times people will say coming to group, they know that it's a safe space where they can share very openly, very honestly, and not have to worry about, protecting other people or censoring themselves. But one of the really big benefits from group is just getting that really supportive response. Groups recognize that we can't fix a lot of what's going on. We can just carry it. We can kind of sit with it. And so groups aren't going to, participants in groups aren't going to throw all kinds of solutions and suggestions at you, or brush what you're saying aside, or minimize it in any way, which sometimes people who haven't been affected by a diagnosis, they just don't know what it's really like to live with one, or, to care for someone, or to live with grief. And so groups are great for just kind of being around other people that speak that same language that you found yourself having to learn.
So I'm going to talk a little bit about the logistics of what the space looks like and what groups look like. So right now, currently, all of our groups are virtual. But when we are in the office, we're in one of the two group spaces that we have at LivingWell. So generally some comfy chairs, and it's kind of shaped more in a circle. And you're able just to kind of have that space and everybody be in the same room. With it virtually, it looks a little bit different. We are using Microsoft Teams, which I think currently is you can get up to 9 people panel view, but I think for some reason it might go up to 42 or something. I don't know. So we don't have groups that size. So you're not trying to finagle for space to talk. But generally, if somebody's new to the group, we do, everybody kind of runs their groups a little bit differently. We do have a group facilitator, somebody professional that's in that group, either professional, one of the counselors, a LivingWell staff, Northwestern staff, or a volunteer that has been trained to help facilitate groups. So the groups aren't just self-run. And usually, if there is somebody new in the group, we will have some introductions. It kind of depends on the day of what those introductions may look like. The biggest thing that I always say to every single person that walks in through the doors or pops up with their screen virtually for groups is that there's never any pressure to to participate at all or to try to have a certain level of participation. We often, probably all three of us, have that comment that sometimes there's days or nights in groups where you do have a lot that you're wanting to get out and get that support from, and then there's times where maybe you're just able to sit and listen to other people talk. And again, hopefully with the amount of time that we have, that everybody's able to have that space to talk or to not talk. And then there's also, most of our groups, we don't have any set topic. It's really about, this is for each and every person that's coming in the group. So I always say that I don't bring in some preconceived idea of what group might look like that evening. It's just about what people, each individual is bringing in that night, and we go with what the group really needs to talk about that night, which hopefully is best for each person. So that's a little bit about what they look like.
And then a lot of times we get asked, what's the difference between counseling or support groups, or how do I know which type of support would be better for me? Obviously we're a little biased, but we think both can be really helpful. If you're wondering what's better for me, I tend to break down into 3 categories, the types of people who wind up in a support group. So some people are looking for a lot of what Christine described, that shared experience, shared language, that safer space to be honest about what's happening, and that sense of camaraderie. They go to the support group, they get that, and that's really all they need and what they're looking for, in which case a support group's probably all that they need. That middle group of people, they're looking for, again, that sense of camaraderie, that shared language, shared experience, but because it's a support group and you're sharing time with other participants, there's not always the opportunity to spend a lot of time or go into much depth with what's going on with you individually. So for those folks, we tend to recommend counseling and support groups, and they can benefit from both. Then there's a third group of people, I think we've all met this person before, who really want to go to the group, are excited to meet other patients or caregivers or other folks who have experienced a cancer-related loss. They get to the group, they appreciate everybody's energy and contribution, but when they leave, it sits so heavy on them. They go home thinking about all those folks. They feel heavier than when they went in. And for those people, we say, well, maybe groups just aren't for you. Maybe you would benefit just from having that one-on-one time where you get to focus on your experience instead of having to sit with others while they discuss theirs. So it doesn't matter so much which type of person you are. It matters more so that you know which type of person you are and choose accordingly. If you don't know which type of person you are, or if you don't know a group is right for you, we always say to give a group maybe 2 or 3 meetings. Groups are living organisms. They're a product of who's in them on any given night and what we're talking about. So meetings can be different week to week or month to month, depending on how often the group meets. So if you're not sure, we generally say to go 2 or 3 times before you make a formal decision.
So hopefully that kind of answers some of your questions that you may have not even realized you had about our support groups at LivingWell. We are going to link just a list of all of the group offerings that we have. If you have more questions about groups or more, want to know a little bit more about counseling or both, please feel free to email us at counseling@livingwellcrc.org. Thanks again for tuning in, and we'll look forward to seeing you back here next time.